Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. John Blair. He's CEO at MedAllies, a Centauri Health Solutions company. Welcome, John.
Great. Happy to be here, John.
Yeah, excited to dive into this discussion. We're here at the Civitas conference. Lots going on, lots to talk about, I think, in this space. We'll get to that. But before we go there, tell us a little bit about MedAllies and also how joining Centauri really strengthens your ability to kind of advance the healthcare outcomes that you've been working on.
So MedAllies I founded MedAllies in 2001.
Wow.
I had been in practice in academics and private practice for a couple of decades. When I did found MedAllies, I'd also been the head of a large IPA, and our focus was on quality. And as the health sector started to get digitized, the IPA, I pushed it toward that, started MedAllies to do that, to improve quality. And we just, along the way, did many things, EHR implementations, quality improvement programs, a lot of work with NCQA, but ultimately got into interoperability. Because as things got digitized, we needed to get connections across providers. So that led me into networks, locally, statewide, nationwide. We did direct secure messaging. Early on, we were one of the reference implementations. So we've run that network for well over a decade.
Wow.
When TEFCA was announced, I said I'm all in, and we became a care quality implementer, jumped right on in. We were a couple of months behind the first pack on the TEFCA designate or the QHIN designation, and we ended up in the group of the first 5 that got designated. So MedAllies now is strictly a national network company running 3 national networks, and we're all in on TEFCA.
That's awesome. So, you've been having a lot of discussions with ASTP, ONC, whatever we call it these days, and other national leaders. What stood out to you, and how do you see the focus on interoperability kind of shifting the industry forward?
Well, so I've been very involved with ASTP, ONC, way back. In fact, if you want to go way back, when it was formed, our region, Taconic IPA, in the first document for George Bush by David Brailer, we were named as one of the 3 regions or 3 communities in the country to watch for the future.
Oh, interesting.
For health IT.
That's going way back.
Way back. I don't know if we lived up to it, but my involvement since we became a designated QHIN has been at the governance level. So I was involved in the overarching governance, Transitional Governance Council in 2024, working with ASTP at that point, Sequoia through that period of time. And now that we've moved in to this year, and the administration and HHS have all decided to continue on with TEFCA, and it's been brought back, not resurrected, but brought back into the full effort. I'm now involved in, again, the Governance Council. I'm the vice chair of the Governance Council, so I'm right in there with what's going on. And the thing that I think is interesting is although it took a while, and I think they were very thoughtful, HHS, CMS, ASTP, and the whole thing, in looking at the landscape, the RFI that CMS did, and trying to figure out what's going on. They got a lot of feedback. They thought about it, I think, carefully, particularly with as fast as they're moving. But what I can say is, once they decided to move forward, and we are one of the, we pledged to be one of the CMS aligned networks, so we were part of that process. But as they've moved on that, they're relooking at everything. I mean, they're looking at all the SOPs under TEFCA, line by line, and really thinking it through. I think there will be some changes. and but what I've really noticed is they are going to move. So I would say what we did last year, over a year in 2024, this crowd is going to move 3 times the pace.
Faster than the previous.
So I think it's probably it's not that they're not cautious, but I think they're going to move faster and not be as concerned about the expense of having to do some iterations to get it where it needs to be. They want to get things done.
Yeah.
So that's the one thing I'm noticing. A lot of it's all the same, but the pace of it is much faster.
Yeah, fascinating.
So, yeah.
Interesting. And what do you think some of the real world outcomes are going to be from TEFCA kind of gaining momentum, being implemented faster? And what will it unlock for providers, payers, patients?
Yeah. So I think those real world outcomes have not changed much in my mind from what they would have been before. Again, I think they're going to be faster. Treatment has been pretty well, those paths have been pretty well established over the last decade through, care equality, e-health exchange, Commonwealth, et cetera. So as TEFCA and the QHINs took on treatment, that has been, I wouldn't say seamless, but pretty fast. And the rate limiting step now is just all the different data sources, particularly the EHR vendors, getting over onto TEFCA. So, that's what we're waiting for there in terms of treatment. But this new administration has really taken on the consumer and the individual's right to have their data and get their data. And so they are heads down on that.
Yeah.
So I think that that's going to surface. And you can be a little bit cynical and say, well, that was supposed to start at the same time as treatment. Well, but that wasn't happening over the last decade like treatment. So there's a lot of things to work out, and I could go on that for a while. I mean, we have 6 individual access service providers that are contracted with us as participants on our QHIN, and they're all in the process. 2 of them are actually live, and HealthX and Selfie, but there's several others that will be coming live in the next several months, and we're really working in the trenches on all the little steps from them getting the querying to get the data and the different data sources responding. But I can tell you that there is a strong interest in getting that going.
Okay.
So that's something that you're going to see. I do think that there's a big interest in trying to get some traction with payers. So there's an interest from CMS to get payer pilots going, and we're looking into that with a few different payers.
Interesting.
So I think that it's hard to see really the value right now for payers because they're able to get the data they need. So I think that if the promise is to increase the breadth of the data, maybe the quality of the data ultimately, have it more efficiently obtained, those are the kind of things that will weigh in time. But I do think that there's an interest in getting payers. And then the other areas, public health, I think will come, but the focus is not necessarily on that today. But there is interest in the Social Security Administration getting going, and I think that's going to be expedited and moving pretty quick.
Yeah, seems like it. You mentioned that you were one of the first QHINs, which is a great accomplishment. How does being part of Centauri, I'd love to hear about this kind of, combination that you've put together. How does that give you the scale and the strength to lead this transformative and accelerate the progress that you talked about nationwide?
Yeah. In early 2024, it became apparent to me with what we bit off with the whole TEFCA QHIN thing, that we needed more resources. Centauri made the most sense to me.
Okay.
Because, looking at them in terms of their culture, their accomplishments, I knew some of the people there.
Sure.
That's the way we decided to go. And I think I've been right. Always coming together, I think, is not
takes
simple.
work.
Well, you're not going to have identical cultures, so it's going to take some time. But we're seeding in. Our direct network is really kind of being combined with the Secure Exchange Solution Network, and they're going to have a best of both kind of Centauri direct that's going to come out of that.
Nice.
But I've been kind of allowed to pursue the TEFCA QHIN component. But a lot of things have come off my plate. I don't have to worry about some of the things I had to worry about before.
Sure.
And certainly the resources are greater. And there's some expertise that I can tap into. So I do think that this gives MedAllies, and again, we're going to be Centauri, gives us the opportunity to do what we would have done before, probably faster, and to be able to take on more than we would have taken on before. Centauri has great relationships with many, many payers across the country. I do believe that, or at least companies that serve payers, is going to be coming into the mix sooner than later. And the Centauri acquisition will really help there.
Awesome. You know, as I think about TEFCA, it kind of sets the framework. But like, how are you helping participants move beyond just compliance with TEFCA and compliance with regulations to really using the shared data in ways that improve care? And what new opportunities do you see? You've talked about some of them with payers, with some public health, you know, but what else do you see coming, and how can you help them move beyond just sharing data to actually using it to improve care?
Yeah. There's about 3 questions there. Hopefully we are strong on compliance and serious about it.
Sure.
And that those that work with us feel that they've got a good partner in that, because if you don't have the compliance, ultimately that's a factor in the trust.
Sure.
And if you don't have the trust, these national networks go nowhere.
Yep.
So it's not that we don't take that seriously, but I didn't get into this for that reason. I got into it at the beginning to improve the health of a region, and still I want to do that to improve the health now, hopefully, of the country, and also to make the lives of the providers that are using these systems less. I mean, you talk about the burden came in way after we started to tackle that, but burden reduction, but also make it more pleasant to take care of patients. So, you know, at the end of the day, what I hope happens with these networks is that you've digitized healthcare to a great degree. It's not all done, but you've done that. But the interconnection that is needed for these siloed systems to really do a better job with your care is still underway. So for me, the better we do this, the more it's going to improve healthcare. So I care about not just connecting and getting the data to move from one place to the other, but the quality of the data, the systems that are connected, how they're configured, so that it's. I mean, a lot of these systems that are out there, provider practices, et cetera, could be used much better. So we care about not just connecting, but how they're optimized for that interoperability, how the data is improved and built into the workflow. So at the end of the day, you really have improved how the users can interact with the systems to do a better job, to take care of patients and make them healthier.
Yeah.
So, and I do think that TEFCA continues on that spectrum, but that's what we want to do. We want to get it all the way there.
Interesting. I'd love to hear a little bit about kind of equitable sharing of data, and how does the Centauri QHIN ensure that the data is exchanged? You know, we already talked about security and compliance and trust, right? Like that, of course, has to be embedded, but how can we make it equitable for all stakeholders, both the large ones and the small ones?
Yeah, so you can talk about equitable between stakeholder groups, providers or payers or government benefit or public health or whatever. You make that equitable by making what's been happening over treatment work for all those stakeholder groups. That's how you make that equitable, and that's the whole, part of the mountain we're trying to climb with TEFCA. If you get it down to providers, whether they're acute providers in hospitals, they're out in rural areas versus urban, or whether you're talking about large integrated delivery networks and providers that are in big practices versus small practices, there's inequity there.
Yeah.
And I do believe that TEFCA and QHINs have the opportunity to bring in, let's just take ambulatory, for example. Let's just take one of our customers, Veradigm.
Okay.
Those are smaller practices, 5 doctor practices up to maybe, a couple of hundred, but, a lot of small practices. And up until a year ago, they were never part of this. They weren't connected to a national network, and they were not in the game at all on interoperability. So you take big institutions on Epic or Oracle Health, prior Cerner, or pick a number of things. They're connected. They can get that data, even though a lot of things are not perfect yet. I talked about workflow and data quality,
Of course.
but they still could get it. And there was great inequity there because the smaller practices couldn't. With Veradigm on, as they roll this out to their full install base, you just brought them equal to a big Epic organization.
And access to all that data.
Absolutely access to all that data. Now, you've still got the things to fix on quality and workflow and everything else, but that's just one example of many on equity. When you look at the hospitals, rural versus urban, that again, more and more hospitals are going to be connected because of TEFCA. So those are just straight up, clear examples.
Absolutely. So as you kind of look into your crystal ball, say 2 to 3 years from now, what does interoperability success look like, and how will patients and communities feel the difference?
Well, so, our health system, certainly in my lifetime, the reimbursement model is never going to be one reimbursement model, and therefore everybody in one health organization. You're not going to have a national health service.
No.
And therefore you're going to have different organizations on different systems. And because of that, you're going to have silos. If you can, think about an Epic think about Kaiser or something like that. If the inpatient side was on a different system than the clinics, and they didn't communicate, it would be,
You provide worse care?
it would be, you would lose out on some of how the job you could do and lose out on quality. Well, that's the way it is today, right? And so interoperability, in my mind, is when you're moving from, TouchWorks to Epic or Meditech to ECW or whatever. The patient is moving between those settings, and the providers in different organizations on different systems are acting as if they're on one system. That they're acting like that Epic organization that has the inpatient, the ambulatory side. When people feel like they're working on one system when they're on different systems,
That's beautiful.
I think you got interoperability. So in 3 years, are we going to be there? No, but we may be 50% closer.
Okay. That's interesting. Yeah, and what's fascinating about that from a patient perspective, they think that already happens.
They do.
And then when they become a patient, they realize it doesn't, and they're like, well, why not? and we know some of the reasons why, but they want that, is my point, and they expect it.
And they should, and that is one of our challenges. And you know, we will. It's funny when I talk about what I did in the past and founding MedAllies. When I was the head of an IPA, or before I became the head of the IPA, when I was on the medical council, every month, primary care argued that they can't get information from the specialist when they send a patient, and the specialist argued that they never could get the information about the patient. And after a year of having to spend the first 30 minutes of every meeting on that, I looked at a friend and said, I'm going to tackle this. That's when I started MedAllies.
Wow.
And I said, we're fixing this in 5 years.
Took a
25
little
years
longer.
later, we're still there. But anyway, that's
It's a complex problem.
yeah, and that's what I hope we can make a dent in.
That's awesome. John, I appreciate you taking time out of your busy schedule here at Civitas to share some of your insights and perspectives, and especially MedAllies coming together with Centauri Health Solutions. It's going to be fun to see you all working together to help solve some of those problems that we talked about and push the industry forward the way it needs to. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, John.
Thank you. Enjoyed it.